Uganda is taking bold steps to tackle pollution through the Environmental Pollution Program in Uganda, also known as EPPUG. This initiative has delivered impactful results aimed at protecting public health and the
So our theory of change encompasses three things mostly. One is to support and to build political willingness, because of course if there is not endorsement and collaboration from the government, things won't be sustainable and can change. The other is, as I mentioned, is to produce really the science and the evidences on why we do this and why we do it this way.
The EPPUG program is implemented by the Global Alliance on Health and Pollution in partnership with National Environment Management Authority, Ministry of Health, Kampala Capital City Authority, and other stakeholders.
The world has over-focused on symptoms as opposed to addressing underlying causes. So until we address the primary causes of the global environment crisis, we shall remain addressing symptoms. So addressing pollution, you will be addressing the primary cause of environment degradation of any segment. Whether you are talking about air pollution remains a big problem. Whether you are talking water pollution is a big problem for us at global level.
The key components of the EPPUG program include development of the Health and Pollution Action Plan for Uganda, a study on health impacts of traffic-related air pollution around Kampala, expansion of Kampala City's air quality monitoring infrastructure, a civil society-led awareness campaign on pollution and its health impacts, review of Uganda's waste management and agriculture policies with emphasis on gender equality, disability, and social inclusion, poverty and health, a study on economic impacts of pollution in Uganda, a civil society-led training on the safe use and handling of agrochemicals. The EPP program is supported by the UK government through the Department for Environment, Food and Rural Affairs.
It has taken steps over the past 5 years to address Uganda's growing pollution challenges, including, among other things, the passing of the National Environment Act and the introduction of the National Environment Air Quality Standards Regulations. We also know that NEMA has been proactive in leading cross-government initiatives in this space. This framework gives us confidence that we will be able to work effectively with you on pollution control that yields the greatest benefits to health and the environment.
One of the program's key achievements is the development of Uganda's Health and Pollution Action Plan.
For Uganda, for the Health and Pollution Action Plan, we developed a preliminary assessment report, but we started this with a number of priorities, including waste management, air pollution, water pollution, contaminated sites, heavy metal pollution.
The action plan is a national roadmap that identifies major pollution challenges and outlines practical and sustainable solutions.
This action plan, the issues we have identified, the actions, once they are implemented, we should be able to add something to addressing some of these issues. In NEMA, we have definitely done a lot as our mandate. We have a number of regulations in waste management regulation. We have air pollution regulation in 2024, but the issue is enforcing these regulations. That has been the issue. And therefore, I want to think that with this action plan, with the strategies we have put in place, this project, this action plan will support the enforcement of these regulations.
The action plan identified air pollution, indoor air pollution, water pollution, improper waste management, and agrochemical pollution as pressing pollution issues in Uganda.
The problem that we are seeing in the city and in part of our industries is that we generate pollution, and that pollution is not managed properly. The solid waste is not disposed in a right way, and also the liquid waste is not treated to the level that meets the standards before it is discharged into the environment.
When plastics are burnt, they release a very toxic air, they release a very toxic smoke, and that smoke is very, very dangerous to our health, especially if we continue inhaling it.
Pollution is driving most death in Uganda. We have realized that people in Kampala are burning waste.
This plan provides a strong foundation for coordinated action across sectors to implement the proposed interventions to tackle pollution.
Pollution is the great killer. Globally, we lose more than 9 million people, which is the greatest number compared to even wars. So pollution is a serious thing. It is imperative to think about what can be done to ensure that to address pollution.
In order to strengthen collaboration and coordination between stakeholders to address pollution challenges in Uganda, Global Alliance on Health and Pollution signed an MOU with National Environment Management Authority.
No single ministry, not even NEMA, which is an agency of the Ministry of Water and Environment, can tackle this challenge of pollution alone. So to my comrades from the government MDAs, we do need pollution and health metrics to be integrated into the physical planning, industrial licensing, and agricultural policies of the country.
Let's approach the Ministry of Finance, let's approach development partners so that they're able to give us resources. It is worth resources so that we are able to start moving. Let's not stop.
To better understand air pollution, a source apportionment study was conducted focusing on traffic-related emissions in Kampala. The study was implemented as a collaboration between Makerere University and Birmingham University. This research has helped to identify the major contributors to poor air quality, enabling implementation of more targeted interventions. Results of this study show that vehicle traffic is a major driver of air pollution, particularly during morning and evening peak periods.
It's very difficult to find a place that has very acceptable clean air levels in line with the World Health Organizations. So it shows that we need to take action.
We have issues of indoor pollution where we have rural communities where they still cook indoors using biomass. Or where in some cases we have communities where animals reside near homesteads or inside home dwellings. We have emissions from constructions. We have issues of water pollution where we have discharge of partially treated effluents or discharge of improperly treated sewage from pit latrines or from sewage treatment facilities.
We realize that these communities are being affected by heavy metal pollution from the activities they do, like metal smelting and fabrication, activities like the use of lead paint within the communities, and even some of the daily activities that happen in our houses, like water coming from the pipes. These pipes do contain a lead, and it's affecting the people's health.
In addition, Kampala's air quality monitoring network has been significantly expanded with the installation of 38 monitoring devices. These systems provide real-time data, improving the country's ability to track pollution levels and respond effectively. The study also developed a Kampala Air Quality Health Assessment Toolkit to translate air quality data into quantifiable health outcomes, including attributable deaths, life years lost, and new cases of major non-communicable diseases. Public awareness has also been a major focus of the EPP program. Through civil society-led campaigns, communities in the Greater Kampala metropolitan area have been educated about pollution risks and how to reduce exposure, empowering citizens to take action.
KCCA is responsible for waste management as an institution, but the Act specifically indicates that waste belongs to you as a generator until the collector comes. As KCCA, we do collect waste. We take all necessary measures and reasonable practicable measures to maintain cleanness of the city.
We identify as priority to address the health impacts of water pollution, and we did categorize our priorities in 3 layers. The first layer was or is water quality monitoring and source pollution control.
We had 5 priority interventions, and they were in 2 phases on generation collection, transporting, and compliance. So our first intervention is sorting at source, and here we shall promote awareness about proper waste management. The next intervention is on the 5 R's: reuse, reduce, refuse, recycle, and repurpose.
The program also reviewed key waste management and agricultural policies, integrating important considerations such as gender equality, social inclusion, poverty, and health. This ensures that solutions are fair and benefit all Ugandans, especially vulnerable groups. Furthermore, studies on the economic impact of pollution have highlighted the financial burden pollution places on the country, strengthening the case for urgent intervention.
If this pollution is generated in terms of solid waste and also in terms of liquid waste and it's managed properly, it would not be a problem.
We must strengthen coordinated action because we all have a role in reducing air pollution to safeguard the air we breathe.
Finally, training and education campaigns on the safe use of agrochemicals have equipped farmers with knowledge to reduce agrochemical misuse and other harmful practices so as to protect human health and the environment.
This has been a process which has been involving all of you and many more. More than 50 experts, Ugandan experts, have been working together to this plan. Why? Because we have compete processes, but we do not implement projects or plans without the local support and engagement of experts, because this is your plan. We would like and we are honored to be the convener of that path and be partnering with you, but as you emerge, we need to unite your forces to make sure that this comes to life, and so that the priority that you describe together for your country, which are supposed to have the highest impact in terms of pollution and health benefit, will be implemented.
Together, these achievements mark a significant step forward in Uganda's journey toward a cleaner, healthier, and more sustainable future.